New testing guidelines from the CDC causing a lot of confusion. Many of you have called or emailed us with questions. Channel 5's Tony Velasquez Jr. got some answers.
When it comes to diagnosing COVID-19, not all tests are created equal. Combine that with the new CDC guidelines that says if you're not showing symptoms, you don't need to be tested, and it can all start to get pretty confusing. We're going to do our best to try and break it down for you.
If you've been exposed to COVID-19, you need to quarantine for 14 days, period. A negative test does not mean you get out of quarantine.
The two most common tests being done today to detect whether or not you have COVID-19 are the PCR test and the antigen test. The PCR test, or what some call the drive-through test, is what's being done at select CVS and Walgreens locations. They're also what the majority of free pop-up testing sites around the RGV are using. Results are often sent to an off-site lab and usually come back within 24 to 48 hours. PCR tests have false positives of 5% or less.
Right now, officially 5% of all people in Cameron County have had COVID-19 by PCR testing. That's a really high percentage of the population.
The antigen test, also known as rapid test, are quicker, less expensive, and require less complex technology to perform than PCR testing. The results for this test come back in as little as 10 to 15 minutes. The downside, they can have false negative rates as high as 50%.
What was happening a lot of the times is people would get exposed, they would get tested and test negative and think they were okay.
And if your test comes back negative, that doesn't mean you've got the all clear.
And that's not the way it works. Those people can turn positive the very next day. And so I think that's probably what was behind that changing guidance.
We also asked Dr. James Castillo about the new CDC guidelines that say if you don't have symptoms, then you don't need a test, even if you're exposed to someone with COVID-19.
I don't think that's what they're saying. What they were saying is whether you're required to get tested. I think anybody who wants to get tested, who thinks they've been exposed, should get tested.
Now, it's important to note that Texas is one of 7 states that disapprove with the new CDC guidelines and says they'll continue to test people who are exposed to COVID-19, whether they show symptoms or not. In McAllen, Tony Velasquez Jr., Channel 5 News at 10.